teleconference agenda 2020-14. Today's date, Wednesday, May 6th, 2020. Good day, everyone. My name is John Catino. I'll be the moderator and host of today's call. I would like to call this meeting to order and inform you all that this meeting is being recorded. Should anyone have an objection to being recorded, you may disconnect now. This teleconference meeting will be run by the agenda, and all attendees will be placed on mute so the primary presentation may proceed uninterrupted. All questions during the teleconference should be emailed to ema@co.delaware.in.us so they may be addressed at the end of the meeting. The invitation came from this email. Please do not place your phone on hold, as a hold message will play to the group. When and if the conference mute is lifted, please keep all side conversations to a whisper and background noise to a minimum, as it will be audible to the group. Should you wish to speak, please state your name and whom you represent. Welcome. Item 1. The Delaware County Health Department, DCHD, reports Wednesday of no new individuals within Delaware County having tested positive through lab testing for SARS-CoV-2, the virus that causes COVID-19 infection, maintaining the latest totals at 215 confirmed cases and 20 attributed deaths. Item 2, the Indiana State Department of Health is opening ISDH Optum COVID-19 testing sites. Testing criteria: individuals who are symptomatic for COVID-19 or close contacts of confirmed COVID-19 positive patients when it is imperative that the contact continues to work and/or have close contact with at-risk populations. The location of this site is 401 North Country Club Road in Muncie 47303. Hoosiers will not be charged for testing, and insurance is not required. If you have private health insurance, please bring that information with you. Register at https://lhi.care/COVID testing or by phone at 1-888-634-1116. Item 3, Indiana State Department of Health call center for the general public and medical providers is 1-877-826-0011. Item 4, returning to open steps for individuals. All vulnerable individuals should continue to shelter in place. Members of households with vulnerable residents should be aware that by returning to work or other environments where distancing is not practical, they could carry the virus back home. Precautions should be taken to isolate from vulnerable residents. All individuals, when in public, like parks, outdoor recreation areas, or shopping areas, should maximize physical distance from others. Social settings of more than 10 people, where appropriate distancing may not be practical, should be avoided unless precautionary measures are observed. Avoid socializing in groups of more than 10 people in circumstances that do not readily allow for appropriate physical distancing. Example, receptions and trade shows. Minimize non-essential travel and adhere to CDC guidelines regarding isolation following travel. Item 5, returning to open steps for employers. Continue to encourage telework whenever possible and feasible with business operations. If possible, return to work in phases. Close common areas where personnel are likely to congregate and interact, or enforce strict social distancing protocols. minimize non-essential travel, and adhere to CDC guidelines regarding isolation following travel. Strongly consider special accommodations for personnel who are members of a vulnerable population. Item 6. Questions on steps to returning to open can be directed to dcema.com, which now has all the steps on the main page and the information about testing sites. We now have time for Q&A. When the conference mute is lifted, please keep all side conversations to a whisper and background noise to a minimum, as it will be audible to the entire group. Should you wish to speak, please state your name and organization you represent. Please do not place your phone on hold, as a hold message will play to the group. Q&A is now open. The conference mute has been engaged for closing. Thank you for joining the teleconference call today. The next update will be announced via email.